Hey everyone, Paul here from Health House. We're going to be talking to some Australian doctors about prescribing medicinal cannabis in Australia. Now, a lot of people complain there's no cannabis prescribing doctors in Australia. Well, I found at least three. The good news is in most states, GPs can prescribe. There are a couple of exceptions, such as Tasmania, and it's a little bit weird in South Australia, but it's certainly a lot easier now to prescribe than it used to be. It used to be a 2-month process. Nowadays, it's a 1-page online form. So some doctors are still reluctant because of the stigma to prescribe, but most GPs can prescribe. And we're heading upwards this year towards 80,000 patient approvals by the end of 2020, which is a big difference from what numbers we used to get. One big disclaimer, that don't take anything tonight, medical advice for your particular condition. Please discuss your particular medical condition with your healthcare professional. And when we're going to go through a few questions to begin with these doctors. And at the end, we're going to be doing Q&A. So please put in your questions in the Q&A section, not the chat function. So yeah, let's get started. So I've found 3 doctors from all corners of Australia. I'm going to introduce them in no particular order. Dr. Maddie Moore hails from Dunsborough in Western Australia. Hey, Maddie.
Hey, mate. How are you?
Yeah, good, thanks. So I'm going to start off with each of you a non-cannabis related question. You live in pristine WA Southwest where I want to retire, and you're not into surfing, you're into mountain biking, I believe.
I am. Yeah, I'm a pretty terrible swimmer. I'm a lead weight, and I make a lot of motion, but I don't get anywhere. So although I am learning, it's slow as you go. So I'm much better on my bike, and yeah, I love it. Lots of good trails down here. So it's good for fitness and good for my head.
Excellent. I went mountain biking with the family down in Margaret River, and we were covered in mud afterwards. So see,
Yeah.
Love you come washing day.
Lots. Yeah, it's good fun down in Margaret River. They got some great trails.
Yeah. Okay. Thanks for joining us. We'll get into some harder questions later on now. Next, doctor I'd like to introduce is specialised in integrative medicine, and she is based in Katoomba, just outside of Sydney, New South Wales. And I'd like to introduce Dr. Arit Holtzman. Hey, Arit.
Hello. Hi.
Thank you for joining us. Now, in a past life, you were airline hostess. Tell us a little bit about that. We want some juicy stories. Have you ever had to restrain anyone? And I presume you were studying medicine at the time. So when they called for a doctor on board.
Yeah, well, it was just for 1 year, and it was after I finished it was in Israel, and after I finished my undergraduate degree in biology and psychology. So I knew that I'm going to keep studying, but I just wanted to do something different, I guess, very different from anything else that I'm going to do in the future. And it's something that I always wanted to do. So I love flying, I love traveling, and I thought it would be a good way to experience that. It was actually terrible. I hated it. The going places was nice. So I got to spend a week a month in New York, which I loved. I love New York, and I actually thought I'm going to end up living there. But instead I came to Australia, which I'm actually very happy about, especially right now. But yes, it was a very difficult job. So I have a lot of respect to flight attendants or air hostesses or whatever the best term is. Especially for the ones that serve Israeli customers. I can say that because I'm Israeli myself. They can be quite difficult and demanding, but it was really interesting. So I did get to travel to lots of places all around the world. But yeah, the strange hours, getting up in the middle of the night to go to work, that was very, very difficult. But I've done it, so now I know that's probably wasn't my calling.
Excellent. And hailing from Brisbane in Queensland, Dr. John Tay, who had the honour of being in the audience of one of our very first seminars in Brisbane, and later on became a keynote speaker and is a massive educator himself and set up Plant Med Clinic. Hey, John, how you doing?
Good evening, everybody.
And pleased to say your side hustle is turmeric. Yeah, tell us about that. Do you have a farm? I know
Yeah, I do. I have a property outside of Brisbane, and we grow a bit of turmeric there, and we produce turmeric beverage. Um, Turmeric, I love turmeric. I think it's a great adjunct medicine for people, or a supplement. It's a great anti-inflammatory. It's known to increase your endocannabinoid production. So it's something which tastes great. And I'm into all aspects of plant medicine and plant health. So anything along those lines is something I'm interested in integrating that in my practice.
awesome. And I'm not sure if I told you, I actually visited a hemp house and the outside walls were covered in turmeric. Yeah, nice
Yeah,
synergy.
great coloring as well.
A little bit bright for my taste. I'd rather something a bit softer than a bright yellow, but yeah, tastes great. You know, I'll probably need some for my knee joints. So I wanted some cannabis questions. I'm just going to cycle around, starting back with you, John. Explain how you got into cannabis as a medicine.
I had a friend back in 2015. A family friend approached me. She had a terrible brain tumor known as glioblastoma, multiform. And she's unfortunately passed away now, but she approached myself asking for help. She's, I don't know what to do. I've heard cannabis is good for cancer. Can you help me? And that kind of started my journey off. And that was just before legalization. So I was doing some research and looking into it. And yeah, she was the catalyst for me, and she remains my catalyst every day. I remember her, and I have a photo of her on my desk. And without Nikki, I wouldn't be here. I really wouldn't. So I have to thank her for that.
Yeah, beautiful story. Arit, how did you first discover prescribing medical cannabis for your patients?
So I did my certification in functional medicine with an American institute. So medicinal cannabis, I guess the focus more on CBD oil was just, part of the management tools that you can use. So the same way you can use turmeric, you can use CBD oil as well. But then when I started practicing, I realized in Australia it's not that simple, and I really didn't have any idea on how to even go about prescribing medicinal cannabis. And I kind of put it on to the side in probably the too hard baskets, like probably a lot of other doctors do. But because I practice in what would be considered, I guess, more an alternative way, some of my patients came to me interested in medicinal cannabis because they've heard it may help them. So I was very lucky to have a mutual acquaintance with Dr. Teresa Taupik, who is one of the pioneers in the field. And she used to live in the Blue Mountains as well. She doesn't anymore, but we used to live in the same area. And I got her book, which I read, and then I actually just gave her a call and asked for some help, and she was very generous with her time and knowledge. So I was able to prescribe for my first patient, but still I didn't feel very confident that I know what I'm doing. And so I was very lucky to be able, I think I attended possibly the first prescribing medicine course that Medijuana provided. And at the same time, they were actually recruiting doctors for Campus Lifestyle Clinic that was about to open in Balcombe Hills in Sydney. So I ended up joining the clinic just a little bit after it opened. So it's a clinic that it's a lifestyle clinic. So we don't just do medicinal cannabis, but we do prescribe a lot of medicinal cannabis. So that's how I started, I guess, my journey with prescribing medicinal cannabis.
Yeah. Maddie, what's your?
Yeah, mate. I just kept an eye on it really, back home, of course. And around the time that I was in private practice before moving to Australia was when, there was a lot of medicinal cannabis being prescribed, certainly in Colorado, where I was in Wyoming, the state north of Colorado. And so, yeah, it's always been in my mind. I've always been kind of keeping tabs and reading. And when things opened up here in Australia, slowly started to prescribe and really have learned a lot on the go. I too, or it had, had taken or had read Teresa's book and also took the marijuana course, and have continue to upskill a bit and keep track and take some courses, some of which are in the States. And yeah, it's been kind of jumped off into the deep end and learn on the go, really.
Definitely. Yeah, well, actually, I might put the link to the marijuana course. I helped contribute for the pharmacy section, and Teresa was actually in the audience of one of our seminars, and yeah, what a great advocate for medicinal cannabis. So, Maddie, staying with you, what's the best result you've seen on medical cannabis on a patient that you can talk about where you've seen results that would get a disbeliever across the line?
One of mine, is that right?
Yeah.
I think the most eye-opening for me was really being able to get one of my patients completely off of benzos and opiates. I mean, that gives me a lot of, it encourages me that we're able to do that. I think that's important, that they can, get off of the dependent medications and onto non-dependent ones. So I think generally that's what, if that gives me the most satisfaction, that's probably that.
Yep. And Arit, what's your best patient?
So I guess maybe not, I can't say the best because there are so many really stories when patients experience such a significant benefit. But I guess possibly the one of the most moving for me was I have a patient that came to me with multiple issues, so chronic pain and anxiety, insomnia, on multiple medications, for pain, for sleep, for anxiety. And it took a long time, so we changed formulations, gradually titrated up his dosing, but he stuck with it and stuck with me, and gradually improved, gradually went off basically all of his medication. And in one of our most latest consultations, he told me that if he would feel the way he feels now for the rest of his life, he would be happy. And that was from a person that really wasn't in a good place when we started. So that was just for me such a moving moment. Really to make makes it all the hard work worth it.
John?
Oh, similar to Aura, there's so many good stories, and it's almost endless, and such good results from this medicine. It's great. Probably an epilepsy patient of mine, one of my older patients, and she had intractable epilepsy for her whole life. She had a bit of a brain chopped out, she had stimulators put in, all sorts of side effects from constant epileptic medications, multiple seizures every day, and it took a while. Epilepsy is not the easiest one, and it's also an expensive one to treat. But we have achieved for her, seizure-free periods of over 6 months in a go now. And we haven't cured her, per se, but to go from something in the region of 30 to 50 seizures a day to periods of 6 months or more between seizures, and when they come, only small. Amazing for her, and amazing to see that and the change in her life from that. It's like she can do stuff now she couldn't before. So yeah, definitely. But there's many stories like that one that I can tell.
Fantastic. Yeah, I've experienced the same. I'll go back to you just briefly. What at the moment we've got a lot of oils. The market's dominated by oils. We're starting to see some capsules, some sprays, some other dosage forms. But what dosage forms would you each like to see starting with you, John?
What I'd like to see that aren't in Australia?
That's right.
I'd like to see 1:1 topical cream. Yeah, I think that's lacking in Australia. There's a lot of skin conditions where you're obviously not going to get a psychoactive effect, but you may get a great result. There's some CBD creams available from compounding pharmacists in Australia, but I'd like to see a THC containing topical cream.
Yeah, here. And there's a lot of CB2 receptors in the skin. Is that right?
There's all sorts of receptors in the skin. There's CB1, there's CB2, there's TRPV. Throughout all layers of the skin, the endocannabinoid system is in full effect. So, you know, you can treat these skin conditions, psoriasis, that sort of thing, internally. And I think we should also treat them externally with cannabinoid medicines.
Absolutely. Arit, what would you like to say?
Yeah, I was going to say exactly the same. So topical creams, and not necessarily just THC containing ones, but I would love to see also CBD ones that are available, not just through compounding pharmacies, and full spectrum CBD topicals, and also not just for skin conditions, but also for transdermal application, for example, for children that don't really tolerate oral administration that well, or even for adults with severe intellectual disability. It can be a fantastic addition, but of course for skin conditions as well.
There's any manufacturers out there, hope you're listening to this. 2 out of 3 Australian doctors, you've heard that, do you, Maddie?
I'll change it up a little bit. I think maybe a THC wafer. You know, maybe, you know, something that's onset of action is quick. But you know, where those folks that can't you know, inhale or in environments where it's not acceptable socially to smoke or vape, maybe a wafer or THC.
Yeah. And next question is, a lot of people complain about access to medicinal cannabis in Australia. What is one thing that the authorities can do to increase patient access in Australia?
Yeah.
Starting with Maddie?
Yeah. I don't know. I mean, I think it's definitely improved a lot. And the times that it takes them to respond is way better. I got into the application process probably later than others. So, you know, Paul, you mentioned a couple of times that, you know, it used to be days and now it's, you know, potentially minutes. So yeah, honestly, I don't know.
Yeah.
I don't know.
Yeah. Before we go to Orit, I've just had one of the cannabis companies actually, they've just messaged to actually taking notes about topicals. So yeah, it shouldn't be too far away.
Sweet.
Orit, what do you think they can do to improve access?
I don't know if it's exactly access, but I think in my opinion, one of the biggest barriers at the moment for a patient accessing cannabis and utilizing it in an optimal way is the driving issue. So it's such a sore point, the fact that it is illegal to drive with any amount of THC in your system, even if there is no impairment. So I, in my opinion, that's one of the main issues that need to be addressed, and quickly.
Yeah. You know what my next webinar is going to be. It's about cannabis and driving. So I'll send an email around about that later. But yeah, thanks for that little plug. John?
Oh, yeah, I think, you know, it depends where you want to go with this. I think some medical guidance is often a really good thing. So I think it's good to maintain a medical pathway. Descheduling is also something which or rescheduling is also something which is obviously on the conversation. And there's been a recent lowering of the scheduling of CBD with less than 2% to an over-the-counter product. Unfortunately, none are registered in Australia, so you still can't get any. That's a bit of a barrier, but I think we're moving in the right direction there. I think there's definitely a distinction between recreational cannabis and medical cannabis and that clinical guidance. So I think if it's going to be in the medical cannabis land, it could be, you know, allowing people to prescribe with slightly less restriction. I know that it must be, you know, followed up and make sure everything's going correctly. But, you know, I think we should trust the doctors more to prescribe these medicines at their discretion. They could still be a monitored medicine like endone or any of the other S8s and still be monitored without such an onerous admin trail that goes along with it. And that will reduce the price. And the price is probably the biggest point for Australians.
Definitely. I mean, there's a big pathway there, and THC eventually might end up as a normal prescription item, i.e. Schedule 4, given that a very large majority of patients don't have psychoactivity from the standard dose. But one day, it is getting better. John, I'm going to start back with you. Have you ever been the subject from discrimination from either any of your colleagues or the public? Have you ever been called Dr. Pot or worse?
I have on telly, actually. Yeah. I have been called no, something like that. And I just blocked it out. I think there's a societal perception of cannabis. I think within the medical community, doctors are generally conservative and risk-averse people. And because of the prohibition that's been on this substance for such a long time, people have already made up a decision, whether that is the correct decision or not. So when we're a referral-based practice at Plant Med, and I can tell you it was very hard to get a referral initially. Those referrals are coming now as people are becoming, they're getting patients come back with good results, and they're like, okay, well, maybe this is okay and nothing's gone wrong with that patient. But there's definitely some preconceived conceptions of what cannabis is, and it's not necessarily a medicine. So there is definitely some, I wouldn't say discrimination, but there's some opinions of other members of the medical community more than anyone else. I think the public is very accepting of cannabis generally. I think the polls in Australia say that over 60% of people think it should be legalized. So, the general perception's okay, but I think within the medical community, at least, there is a little bit of bias, a negative bias against people that are on the forefront of this medicine. And I don't think that's a good thing.
Excellent. Arit, I know you've had past military training, so people wouldn't diss you too much, but yeah, any discrimination coming your way?
It's a desk job, so I can.
That's what all the elite forces say, don't they?
Oh, no, not at all. So, look, no one has called me Dr. Pot to my face, possibly behind my back. I do have one patient that called me Dr. Drugs, but I think it's as a terms of endearment. I had maybe a couple of times when I had some issues with specialists that were not very happy with what I'm doing. But it was really, just I guess in terms of they weren't really that well informed of what cannabis can really do to their patients and what are the risks or the safety profile of medicinal cannabis. We do get more and more referrals in our clinic as well, not just from GPs, from specialists as well, which is great. So from neurologists, psychiatrists, pediatricians. So as there's definitely progress. So over the I guess year and a half that I've been working in the clinic, there is definitely has been a change in the way that patients get to us. So it's not just word of mouth now, it's from their actual doctors referring to us. So I'm sure that there is still stigma, and I won't be surprised if there is some talk behind my back. But I think there is more and more acceptance as well.
Yeah, I wouldn't dare. Yeah, Maddie?
Yeah, Paul, I think by far the most skeptical and biased and uneducated population is really doctors. And I've had certainly was aware and more careful at first and didn't want to be called Dr. Pot, but after all of the the anecdotal evidence certainly of my patients from onset into a month or two after starting completely changed my mind. And I'm not so concerned about that. And I live, as you know, Paul, I live in a very cannabis friendly area of the country, and so I don't think patients really worry about that too much. It's really the docs, but referrals are increasing. People are more aware, and I think the tide is changing for the better.
Well, if they call you anything behind your back, there's huge support. We ran a seminar recently in the town of Dunsborough, which is Maddie's town where he practices, and it was a full house without any advertising, and there's a sea of grey hair people looking to get relief over and above the current medications they're currently taking. But yeah, that's going to be all from me. I'm going to hand over to my colleague Dunya, who's going to run through some of the Q&A questions. But yeah, thanks again for joining us. I'm just going to switch up the view. Cheers, Paul. Everyone can see
Thank
us
you.
at once. And Dunia's got some great questions lined up.
I know. Hi, everyone. I've got a few already lined up, so I'll just go straight into it, I think. We had one from an anonymous patient where they've been prescribed an oil, and I guess this goes back to you, Orit, in terms of driving. I'm sure you'll explain more in terms of whether they're able to drive or not safely with a medicinal cannabis oil, if you can cover that.
It is illegal to drive with any amount of THC in your blood or saliva. So it's not even about whether you are able to drive safely or not. That really depends on the dose you're taking and how it affects you, how long has it been since you've taken the dose to the driving. But that's not even relevant at the moment in Australia. So it's, as I said, it's illegal to drive with any amount of THC in your system, and you may test positive even days after taking your last dose. So any patients taking medicinal cannabis is advised that they should not be driving.
Yeah, beautiful. I guess, do you also get patients not being usually able to drive because of certain medical conditions they already are on as well? Yeah. Yeah.
So it's not a barrier for all patients. Some patients don't drive anyway. Some are happy not to drive. So it's not always a barrier, but it is for many patients.
Okay. Yeah. I might go to the next one. That was from another patient that's suffering from chronic migraine, and it's significantly impacting their mental health and weight as well. So is medicinal cannabis an option possibly? I'll jump to you, Dr. Tay, in terms of how would this be best discussed with their GP, and that factor of weight particularly.
Yeah, I mean, the factor of weight could be many, many things. Migraine, I think, is definitely something we can assist with cannabis medicines. And it's actually one of the ailments which is on the list developed by Dr. Russo in terms of the potential for an endocannabinoid deficiency. So a lack of production of your own endocannabinoids. There's a group of diseases that are in that, and migraines is one of those that is listed. The way that I treat migraines is definitely to start with some CBD oil and a THC oil, depending on when the migraines come and how severe. Are they every day? Are they weekly? You know, but general support and in a way prophylactic prevention with those CBD and THC oils. And once I have someone tolerated to the THC oils, if we're still getting migraines, then I will consider adding in an inhaled product for quick relief of those migraines. When not waiting until they're full blown. The cannabis medicine is a little bit different like that. You don't think, oh, I've got a really bad headache, now I'll take some cannabis. You take it before you have your headache, and when the premonition is coming on, that's when you would use your inhaled product. So that's how I generally approach things. And how would you approach your GP? Just ask them. Just say, look, I've tried Lyrica, I've tried Endone, I've tried the endless list, Migraine, the massive list of medications that have been tried for migraines, often with no use or minimal effect. And say, you know, is there anything else for me? I've heard medicinal cannabis may be beneficial for me. Can you prescribe it for me? Or can you provide me with a referral to someone that is knowledgeable? So one of the providers in Australia who, you know, specialize in this sort of area. So migraine is definitely something which I have a lot of patients with. Yeah. And it's pain. Migraine is pain, discomfort, pain. So that's how you deal with it.
No, that's very good advice. I think for a lot of patients that call us up as well, for pharmacists, a lot of us do realize when they have tried all other aspects of not just medications, but basically other types of therapy as well. So
lifestyle modification, diet modification. People have tried everything, and you know, I'm not sure of the exact statistics, but it's a very large number of people in Australia that suffer from migraines. I think it might be upwards of 15 to 20%. It's a lot of people.
And we're able to prescribe medicinal cannabis when those conventional therapies fail, and you know, So that's yeah, that's definitely something. If you qualify there, talk to your GP.
Yeah.
Yep. All right. I might jump to you, Dr. Moore, as well for the next one.
Okay.
Have you found, I guess, when you are considering prescribing medicinal cannabis for sleep or insomnia, whether you have had many drugs interact, particularly someone has asked about melatonin as an example, would it potentially block or enhance that effect?
Yeah, not from my experience. I mean, I think the
Yeah.
mechanism is different as far as, metabolism of those medications. Your cannabis is liver metabolized through the P450. I'm not really sure. Do you guys know if melatonin is? I guess, Dunya, you'd be the one to.
I'm laughing because it's definitely not by one of those CYP450
Yeah,
enzymes.
I didn't think so.
Yeah. I
no,
guess it's hitting different receptors of the hypothalamus compared to, that's how I understand it from what THC and CBD, well, THC, I should say, would. So very unlikely.
I don't think there's any interaction or contraindication to using both.
I have plenty of patients that take melatonin, and I never tell them to stop it, and I haven't had a problem.
Yeah, good.
Yeah, so there's no contraindication there. And even if you're looking at a liver metabolism, usually the levels of CBD used are not going to really be affecting that the CYP450 that much in that sort of case for sleep and that sort of thing. So yeah, I haven't found any problems with that particular supplement.
Yeah, definitely. Is there some drugs that I'll jump it out to everyone in terms of have found problems with? Because I've heard certain ones like clobazam, for example, do have this quite significant interaction with making an active form that creates toxicity for clobazam. But is there some that you guys watch out for when you do start initiation for medicinal cannabis?
Oh, 100%. Yeah, so a lot of the epileptic medications are definitely metabolized, and in the case of epilepsy, we're using high-dose CBD. It becomes very relevant. Also, you should look out for some anticoagulants. So warfarin, apixaban. I've had someone with slight bleeding tendencies with apixaban on high-dose CBD as well. But it really is the CBD, which is the interaction in that sort of sense. They're the main ones that come straight to mind, and clobazam is another one which is is notorious for being a lot stronger than you might expect because it's exclusively metabolized by that cytochrome P450 system.
Yeah.
It's just important in those cases with the anti-epileptic medication to monitor blood levels as well, and not just for side effects, in order to prevent those significant interactions. But I guess the good news with the anti-epileptic medications, which are many people worry about, so apart from clobazam, a review of the interactions with the common anti-epileptic medications show that while high-dose CBD did change serum levels, apart from clobazam, none of them was out of the therapeutic
window.
So, so that's encouraging, but yeah, of course, it doesn't mean that we need to be, too confident. So we do need to be mindful of those interactions. The other thing I am mindful of is benzodiazepines, because there can be an effect. So again, it doesn't mean that patients need to stop those medications when they start on medicinal cannabis, but it's just being careful and mindful of side effects.
Absolutely. And that, in that case, more sedation, for example, is that what you'd watch for? Yeah. Okay, cool. I feel like I'm learning a lot as well. Someone has asked, particularly for chronic pain, what have all of you read, I guess either recently or over time, with what evidence there is out there in terms of efficacy and safety, and what randomized controlled trials you really abide by in order to prescribe it. So I'm sorry that it's a quite open-ended question, but maybe I'll start with you, Dr. Moore, in terms of, are you prescribing it mostly for that condition, for chronic pain?
Yeah, I mean, I think my prescribing certainly parallels Australia's statistics. At least, you know, I believe in 2019 December there was 70 to 80% of our prescriptions were for chronic pain, and I think that's probably consistent now. So yeah, and yes, we do follow you know, clinical trials. We're behind a bit, obviously, in the long-term data and the amount of research that we have, but we're catching up certainly over the last 10 years. You know, there's studies for fibromyalgia, there's studies for osteoarthritis, you know, neuropathic pain. You know, there's a study that shows that medicinal cannabis is at least as effective or more effective than Lyrica. So yeah, there's definitely studies that we abide by or you know, refer to in order to qualify or and prescribe.
Absolutely. More and more is coming out as well with evidence. So there's lots, particularly on the TGA website, they've done a summary, but I've had a look at the ACRE guidelines recently, and maybe Dr. Orr at your modules soon as well, I'm sure. So, all right. So I might cover the next topic, which is what informs your decision as a medical practitioner when you're considering which product to prescribe and why. So I'll go to you, Dr. Holtzman, with what you would choose and why for a patient.
Oh, sorry, what would, can you repeat that?
Oh, yeah, sure. What sort of factors do you consider when prescribing a particular brand or product of medicinal cannabis, and why?
Sure. So, really, I think the most important consideration is the patient themselves. What's their medical condition? What's the comorbidities? Their age? Their sensitivity? Their previous experience with medicinal cannabis? I mean, do they have any previous experience? Are they completely cannabis naive? Issues about their work or driving. So all of these really will come into consideration. And according to this, I would decide on which ratios of CBD to THC. With regards to dosing, it's always, you know, start low and go slow in my practice, and I think with others as well. So it's really those are the main factors will guide my choice. I guess with different, there is also with different clinical indications, I have ratios that I would more tend towards, but it's not a blanket rule.
Yeah, makes sense. Clinically, definitely is the way to go.
Yeah, I think there's a lot of overlap there, you know, even with certain conditions, and each patient is a different system, and each system is different. So I think, you know, for instance, if it's an oil that we choose to prescribe, you know, I think for the most part, on average, most of us would use a balanced oil, at least to start, and then adjusting the ratio either back or forward based on their response.
Yeah, definitely. I've had another question kind of that relates to this, where would, you know, shortage of medications be a problem as well with prescribing? So I'm sure all of you do consider that as well, with changes in availability and having to import some of these things from overseas. So I might do an interesting one next with the topic of dementia. Someone has asked about whether you're seeing patients being prescribed that now, or you are already initiating treatment with medicinal cannabis. Have any of you started for a patient?
Yeah, for sure.
Okay.
I have quite a few elderly dementia patients, you know, neurodegenerative diseases, Parkinson's, Alzheimer's, all these things. And often they're in nursing homes, so you need to maintain a very simple dosing regime. I'll often just use a capsule where possible because of the simplicity. and a twice a day or 3 times a day dosing with a low dose balanced sort of medicine helps.
Yeah.
In terms of the patient, what benefits do they get? Well, that often people in those situations have pain which they can't explain because they're unable to communicate it. So it helps with their comfort. It helps with their sleep. It reduces anxiety in those patients, and it makes the family and friends and relations and carers for those patients' life better as well, less stressful. So yeah, that. I have quite a few patients in that sense, and there's no need to, go over the top with your dosing. Somewhere in the region of 5 milligrams of a balanced medication 2 to 3 times a day seems to be more than enough to improve quality of life for these patients and their families. So it's definitely an area which I've got a few patients in that sense.
Yeah, definitely. I'm really glad you consider formulations as well for those cases, because we get a lot of queries about particularly nurses struggling with oils and even creating pre-filled syringes, for example, to
that's
just have it
a
ready.
big problem, because when you have nurses and you try to give them a 6 week up titration, it never works. It never works, and they never
very
stop.
fiddly.
They never stop at the point where it needs to be, and then they'll overdose the patient by continuing up the titration when symptoms are relieved. So I try to take any of those variables out of my treatment of patients. If it is an oil, it'll be a 1:1, a simple 1 oil, not 2, where possible, a capsule. Yeah.
And I might go back to the person that inspired you as well, Dr. Tay, in terms of, do you still tend to prescribe medicinal cannabis as an adjunct to different forms of cancer for your patients?
For sure. Yeah. Cancer is a thing that is so varied and so many different types, and there's often pain involved. There's often anxiety involved. There's often sleeplessness. There's the side effects of chemotherapy and radiation to mitigate. So, cancer is definitely an area which I think there's a lot of patients already in Australia treating or being treated with cannabinoids for. And once again, it's patient comfort, and that's emotional comfort, physical comfort, relief of nausea, increasing in appetite. So definitely there's a lot of cancer patients that come through our clinic, and it's a great adjuvant medicine. It helps in so many ways, dealing with often very testing and strenuous treatment regimes for these people, and massive changes in their life, often unexpected. So yeah, definitely a lot of cancer patients coming through as well. And, people don't always expect that they're going to be suddenly cured from their cancer. That's not the main thing that people coming to you for in this sense. It's usually just, can you help me feel better in these final stages of my life? Can you assist me here? So look, there's the occasional great story that you see around, that I've seen around and you see on the internet and TV, where people get a miraculous recovery. But in general, there's so many variables, and it depends on where you are in your cancer journey. Have you got, metastasis throughout your body? And it's unlikely that you're going to recover. So there's lots of variables to take into account, but regardless of what endpoint you're hoping for, there's definitely benefit for cancer patients with medicinal cannabis.
Yeah, absolutely. We had another question as well. I guess when we're looking at going to clinics, sometimes you find these cannabis only access clinics compared to, say, going to your own GP. Would you guys recommend one or the other for a particular reason for a patient? Maybe I'll start with you, Orit.
Well, I think it really depends situation again and the patient. So if you have a good relationship with your GP and you think they will be open to it and happy to learn about it, I think it's great if it can be just part of your usual care. But if your GP is not familiar with medicinal cannabis, then it's a great option as well to be able to be referred to a doctor that has more of a specialized knowledge in prescribing medicinal cannabis. There is a lot to prescribing medicinal cannabis. It's not just one product in one dosing, in one ratio. So it can be quite complex, and in order to, I think, do it in an optimized way, you really need to make sure as a doctor that you are familiar with what is available, with the research, with the developments. So it's not something that every GP is comfortable doing, and I think that's okay. And that's where there is a place for cannabis. I don't like really the term, I guess, cannabis access, because it just feels,
Yeah.
it's just you get a script and you go on your way and that's it. It's to be treated by a doctor that has special interest in medicinal cannabis and specialized knowledge in prescribing and managing patients on medicinal cannabis. So I think there's room for both, and it really depends on the situation.
Yeah, absolutely. I agree. I think every time patients do call us as well, I always try and guide them to the GP first, because they've had a history with them for much longer than walking into someone new as well. So just depends on comfort, knowledge, like you said, and how quickly can you access it. So I've had so many more questions come through, I feel like, in the last few minutes, but I'm going to have to cut it off here. And I really want to thank all three of you for joining us tonight. It's been so informative, and I hope for both sides as well, not just me, but you as well, and the viewers out there. Our next webinar is actually going to be on the topic of cannabis and driving, and that's going to be October 21st at 7 p.m. Eastern Standard Time. So if you're free, then come join us as well, because that will cover a lot of some of the grey areas behind each state and how to manage that with medicinal type of cannabis prescribing and driving regulations. So I hope to see you all there, and thank you again so much for joining us tonight.
Thank you.
Pleasure.
All right, take care.